Good morning everyone, with me Sindy Finda Kawulur. I will accompany you on today's news. A search info like human metapneumovirus case in China has raised fears of another COVID-style pandemic. Images of hospital filled with mixed patients have been widely circulated on social media. But health experts say Hmpv is not like COVID and suggest that it has been around for years. They say China and other countries are only experiencing the seasonal increase in Hmpv that is usually seen in winter. First identified in the Netherlands in 2001, Hmpv spread through direct contact between people or when someone touches a contaminated surface. The virus leads to a mild upper respiratory tract infection for most people. It's usually almost indistinguishable from flu. Symptoms for most people include a cough, a fever, and blocked nose. The very young, including children under 2, are most vulnerable to the virus. It also poses a greater risk to those with a weakened immune system, including the elderly and those with advanced cancer, according to Su Liang, an infectious disease specialist in Singapore. If infected, a small but significant proportion of immunocompromised people can develop more severe disease where the lungs are affected, with wheezing, breathlessness, and symptoms of croup. Many will require hospital care with a smaller population at risk of dying from the infection, Dr. Su said. And like many respiratory infections, Hmpv is most active during late winter and spring. This is because viruses survive better in the cold and can pass more easily from one person to another as people spend more time indoors with closed windows. In northern China, the current Hmpv spike coincides with low temperatures that are expected to last until March. And many other countries in the northern hemisphere, including the US, are also experiencing a growth in rates of Hmpv, said Jacqueline Stephen, an epidemiologist at Flinders University in Australia. While this is concerning, the increased prevalence is likely the normal seasonal increase seen in winter, she said. The World Health Organization is monitoring rates of flu-like illness across the northern hemisphere and said it has not received any reports of unusual outbreak patterns in China or elsewhere. It said Chinese authorities have confirmed that the healthcare system is not overwhelmed, and there have been no emergency declaration or responses to date. The incidence of Hmpv in the UK has risen steadily since October 2024. The UK Health and Security Agency does not publish the number of cases recorded, however, its latest data show the percentage of people testing positive for the disease rose sharply in the third week of December and remained at the higher level of the following week. But the UK SSA say this is completely in line with normal seasonal trends, and the level of disease being seen in GP surgeries and hospitals is as expected. Fears of a COVID-style pandemic are overblown. Experts say nothing that such events are typically caused by new virus, which is not the case with Hmpv. The disease is already globally present and has been around for decades. This means people across the world have some degree of existing immunity due to previous exposure, Dr. Su said. Almost every child will have at least one infection with Hmpv by their 5th birthday, and we can expect to go on to have multiple infections throughout life, said Paul Hunter, a medical professor at University of Anglia in England. I don't think there are currently any sign of more serious global issue. However, health officials recommend taking sensible precautions to avoid catching Hmpv and other respiratory illnesses. First, wearing a mask in a crowded place. And 2, avoiding crowds where possible if you are at high risk of more severe illness. And 3, washing your hands regularly. And the last, disposing of tissues securely. People may also wish to consider getting vaccinated against other respiratory conditions such as the flu. In the UK, pregnant women and adults aged 75 to 79 are advised to get the respiratory syncytial virus vaccine, but can sometimes be serious for babies and older adults. That's all for today's report. I'm Sindy Finda Kawulur. Good morning and see you.